It was 2 years ago that our world began to shut down as the coronavirus rapidly spread across the globe, infecting hundreds of thousands in the span of weeks. As what first emerged in downstate New York, COVID-19 quickly made its way to the North Country by late March of 2020. Now, 2 years later, COVID-19 has infected tens of thousands of local residents and taken nearly 400 lives across Jefferson, Lewis, and St. Lawrence counties.
I think about it 2 years ago, I got a text message from my supervisor, the director of public health, Ginger Hall, that said, can you meet with BOCES and all the school superintendents today? It was a Saturday. So we all met because we needed to determine, we hadn't had a case here yet, but we needed to determine what were we going to do. And of course, at that time, it was a new disease across the whole world. And we didn't know if it was going to be incredibly deadly or not, or what was going to really happen. It was all the unknowns.
It's been a whirlwind of 2 years for our department here. We've always worked together on different programs, but we've never worked on one project as a whole department before. So it was a unique situation where everyone had to come together and found out, how well we really work together.
But as many know, COVID-19 infections and transmission rates have hit the region and state in waves. The first wave occurred back in January 2021 when the Delta variant arrived in the region. The second spike, which infected much more but not as deadly, hit the North Country in early February following the emergence of the Omicron variant.
So here would have been January 21 where we went up, and here would be January 22.
Although the pandemic itself was unprecedented, in Jefferson County, what shocked local leaders the most was the passion on both ends of the political spectrum regarding the virus.
So I would say the passion of people on very polarized sides of the coin, people who have been very afraid of catching COVID or spreading it to other people. And then the people who believe it's just not true. So we have those people on both sides, and both of those ends of the spectrum are very vocal, and the middle people aren't as much.
And a similar theme was echoed in St. Lawrence County.
So one thing that has been surprising a little bit is some of the pushback that we've had on the science in our community. COVID is new, and so it was constantly changing. And we expected it to change as the research happened. So some of that pushback was surprising, and we're still getting denial that COVID isn't real, it's not serious. So that in and of itself is still surprising.
But the partnerships were what was said to be the region's biggest success during the pandemic.
I think our county has done an excellent job of fostering our community relationships. So between just the inter-county departments, the schools, colleges, businesses, we're part of a reopening task force. I think we have done a really great job of building those relationships that we can continue to use for other public health matters in the future.
Now, as year 3 of COVID-19 begins, mask mandates are being lifted, public gatherings are becoming more common, and life seemingly is becoming more normal. But as the entire world enters year 3 of COVID-19, protecting the most vulnerable remains the top concern.
I think our focus now really has to be protecting those that are most vulnerable for being hospitalized or passing away from COVID. So now we have that ability, like we do with other diseases. We know who's the most vulnerable, and we know it's not necessarily dangerous for all age groups. I think it's really important to think about that. This doesn't mean that it's over. Not that I want to keep it going, but it does mean that we can relax all these mandates, but still we want people to wash their hands.
We as a community have learned the importance of public health, and not just COVID in general, but maybe some of the underlying conditions that we have in our community that make us more susceptible to certain diseases, and that we can work together to try to reduce those other conditions as prevention measures in case of a future outbreak.
For ABC 50 Now in Watertown, I'm Isabella Colello. For more local news, go to informnny.com or download the ABC 50 mobile app.